Doctors of Reddit, what's something you've had to tell a patient that you thought for sure was common knowledge? In a free medical clinic I had to tell a mother that she should be brushing her 4-year-old's teeth. The daughter came because her throat hurt. After opening her mouth using a tongue depressor to see her throat, the daughter squirmed like 4-year-olds are prone to do. The tongue depressor hit her gums. Pus flowed everywhere. The child wound up having to be put on penicillin before having every last tooth pulled due to severe infection. Edit. RIP my inbox. You should start brushing your infant's teeth as soon as they start teething. Do a gentle gum massage with a baby toothbrush before that. Use safe to swallow toothpaste before the child is 10. Let the child brush their own teeth as soon as they are able for practice, and then have an adult brush them at a 45-degree angle towards the gums in small circles. Children should be supervised brushing their teeth until they are at least 12 or longer, if necessary. This occurred in Nicaragua, quite far from any major city, and wasn't reported because the mother did follow up and kept the appointment for extractions. The thought of brushing her daughter's teeth simply never arose. Before modern toothbrushes were invented, people used bones, porcupine quills, sticks, and chew sticks. The ancient Romans had toothbrushes as well. Here's what they looked like. Yes, you should brush your pet's teeth. Pet toothpaste only. No fluoride. No, I didn't murder the mother. She was provided with 6 months worth of dental supplies for both of them and thoroughly educated on dental hygiene. Edit 2. Mobile error. Not a doctor, but my ex-girlfriend had a severe peanut allergy, and one time she ate a Thai chicken pizza in the college cafeteria that did not list peanuts as one of the ingredients. After her throat started burning, she knew something was wrong, so she grabbed a glass of milk, which I guess helped a bit, and went outside for some air because she was having trouble breathing. A female security guard was passing outside in front of the building and saw that she might need some help. At this point my ex was looking through her bag for her EpiPen. The security guard asked what was wrong, and she tried to explain that she had a severe peanut allergy and needed to be taken to the hospital. When the security guard saw her take out the EpiPen, she took it from her and said that it was school policy that she be the one to do it. She then asked my ex to hold out her arm so she could inject her. My girlfriend could not believe that the security guard was trying to inject her arm like it was a flu shot, and out of frustration, she yanked it from the guard's hand and put it in her thigh like you are supposed to, and sternly told her, "I need to get to a hospital now." So this happened when I was a family doctor. I got a call in the middle of the night. I was on call from a very distressed new mother. She said her newborn was projectile vomiting with every feed. Projectile vomiting can be a worrisome finding in a newborn, so I asked her to meet me in the ER right away. When I saw the baby, he was smiling, happy and in perfect good health. The mom assured me that he vomited with every feed, so I asked her to feed him to let me see what happened. She did, and as soon as she finished, the baby started to fuss then spit up the milk. I asked was this what she had been seeing. It was. So I asked her if she ever burped the baby. She looked at me puzzled. She had no clue about burping. She said she thought it was some TV thing. I assured her it was a real thing, and at 2 AM taught her how to burp a baby. I asked her to follow up with me in a day or two. She came in and said, "You are the best doctor ever. That burping thing you taught me is like magic. Now my baby is happy all the time." So there you go. Someone who did not know about burping a baby. Edited to at kidshealth.org/parent/pregnancy_center/newborn_care/burping.html. NB I'm not sure if this is a mobile friendly site. It not just Google burping a baby. Some people don't handle stress well. I volunteer as an emergency first responder, but one of the funniest cases I've seen of this was out of uniform in an airport. A larger gentleman who suffered from COPD had taken a 6-hour flight. Upon getting through security he had collapsed and was having difficulty breathing. The first person on scene to help the guy was a firefighter. I was second on scene, younger and smaller than the firefighter. I'm 6'3" and not skinny. This guy was just huge, so I'm letting him take lead as I run through making sure EMS is on the way, checking the guy's vitals, stabilizing his head and neck. Big guy went from conscious to unconscious quickly and fell straight down and getting a history from his family. In the meantime the firefighters kinda starting to panic a little. He may have been new or just the fact that he was out of uniform and not expecting it through him. Either way, as the man regains consciousness and I start running through a quick GCS test, which involves me and the gentleman talking to each other and treating for shock, the firefighter tries to retake the guy's vitals. He fails to find a pulse. Understand at this point I'm communicating with the patient. He's not completely lucid, but he is speaking to me and groaning. Having failed to find a pulse, the firefighter assumes this gentleman is in full-on cardiac arrest and begins to attempt to apply a need to his chest. I say attempt because, along with being large, this gentleman was somewhat hairy. Point now in any first aid course for anyone that involves teaching one to use a need, one of the things you cover is that the razor in the kit is there in case you need to shave someone. The firefighter, having failed to realize that talking probably means the patient isn't in cardiac arrest and that he is having trouble getting a pulse because the patient is larger, then fails to shave the guy's chest. This leaves the patient with the 2 contact pads hanging off of his chest hair, but very much not in any way contacting his skin. While I've just started to realize what the firefighter was trying to do at that point, fortunately, an older woman arrives and identifies herself as a trauma nurse, who are, by the way, just about the best people to have on your side if something like this happens. She tells him to go talk to the family, takes lead, and everything goes smoothly from then until the airport medical folks show up and take over. Unfortunately, I'm having trouble not laughing the whole time at the image of the firefighter staring intently at a need that can't possibly give him a reading on the condition of the now conscious and lucid patient. TLDR, even people who should know better sometimes lose it under stress. Here's my time to shine. So it's intern year of my surgery residency, and I was sent down to the ED to see a patient that may have a hernia. I went down to see the guy and he looked like a John Denver lookalike with obvious psycho/social deficits who was sitting comfortably. I begin my usual line of questioning, and the guy lives by himself, has a girlfriend, and he had this pain in his groin for a few months now. So I begin a physical exam, and when I get to his inguinal region there is obvious swelling with something hard in the canal. I then do a testicular exam, and I feel that the guy has only one ball. Very rarely people with inguinal hernias have their testicles retract in their inguinal canal. It can be dangerous if the blood supply is compromised. So I ask the guy, how long has he had one ball? He looks at me like I'm crazy and says, what do you mean? It's always been like this. I'm confused and try to rephrase the question, but the answer is the same. I'm so confused at this point and explain to him that he should have 2 testicles and he has only one. He begins to argue with me and claims that people have different amount of testicles and he was one of the ones with one. At this point he starts to develop an attitude, so I skip over it and schedule him for emergent surgery and speak to my attending. I'm the one who gets to scrub into the surgery, and I go to the pre-op area to meet my attending, and he's there talking to Uniball. Uniball and his girlfriend start pointing at me and getting heated with my attending. I approach them and ask them what's going on. They start shouting that I tried to trick them into thinking there was something wrong with the dude's testicles and I caused unnecessary worry. The attending and I had to explain to the dude and his girlfriend that the overwhelming majority of people have 2 testicles and it was abnormal to have just one. They refused to believe us. So we end up taking him to the OR and pulling the hidden testicle out, and long story short, it was like a testicle diamond. It was rock hard and super compact. It looked like a super dense hard oyster. Just so you know, TLDR, I had to explain to a guy and his girlfriend that it was not normal to have anything but 2 testicles. They still don't believe me. Edit. So 1. His testicle somehow retracted at some point in his life. 2. I reiterate the dude looked like John Denver, so the girl wasn't exactly a looker. I'm assuming she wasn't with many guys. 3. No, it wasn't viable. 4. No, it didn't have cancer. Not a doctor, but a nutritionist. I work with a lot of different patients, and I have tons of stories about food stupidity. Had a lady have bariatric surgery. Your stomach gets surgically stapled smaller, and her mother kept trying to force her to eat real food the day of the surgery. When she was on a liquid diet, she would eat it, puke, rip her stitches out, repeat. We had to ban the mother from seeing her because she would literally blackmail and guilt trip this poor lady into eating a whole pizza, barf it all up because her poor post-surgery stomach couldn't handle it, and end up ripping out stitches and causing enormous pain because her mother was positive that she would die if she was on a liquid diet for a couple days. Another lady I was seeing for clinicals was diabetic, and she would come in every week with stupid high blood sugar levels. 250, 560-ish, not knowing why they were so high. She kept a record of everything she ate, and all her food intake seemed fine. One day, her husband came with her, which was weird, and he ninja slipped me a note while shaking my hand. It read, "Ask her about the Quick Trip slushes. She doesn't believe me that they have sugar in them." So I asked her if she was having any soda, lemonade, tea, ice cream, shakes, or slushes, and she told me like a light bulb had gone off in her head. Well, I have been drinking about 3 of the 48 ounces Quick Trip slushes every day for a while now. They are just so good. And they aren't food or drink, they are slushes. So they don't have any sugar in them, and I don't need to record them. It was so hard to convince her that those are so full of sugar it isn't even funny. But seriously, 3 a day on a type 2 diabetic. It was one of the stupidest things I have ever heard in my life. So my dad is a trauma anesthesiologist. My childhood was often colored by grisly stories of gunshot and stab wounds, terrible car accidents, and freak accidents. He worked in a trauma hospital in a city known for its crime. Not Detroit, but he kept busy. His favorite story though, aside from giving anesthesia to a cow, is that a man once came in with big chunks of metal that had entered his skull through just under the eyebrow. The dude was lucky, he lived. Apparently he'd been operating some dangerous machinery, and it had blew up on him. However, when they pulled the chunks out of his head, on a few pieces they could make out factory printed words. "Always wear eye protection." If the dude had had his safety goggles on, you'd think nothing would be entering his head near the eyes. Edit: I said safety goggles because I'm an English major who doesn't operate heavy machinery. You've gotta assume eye protection means face shield or what the fuck ever would be necessary in this situation. I don't know. But the dude wasn't wearing anything on his face when he came in, that's for sure. Edit: to you guys know English majors have more to do with analyzing the color of Gatsby's left nut and less to do with grammar, right? Probably way too late, but I'm a CNA at a nursing home. We got a new resident in, and she had a huge bed sore near her tailbone region that had become infected and abscessed to the point that you could probably have fit a Coke can inside the opening. It had to be cleaned, packed, and have a wound pump attached to it every 12 hours. Turns out, before she came to us, her family didn't think she needed any at-home help, so they would go over in the morning, get her up, bathed, dressed, put a Pop-Tart on the table for her, get her in her wheelchair, and go about their day. She was incontinent and would sit in the chair for 12 to 15 hours a day covered in her own urine and feces until they came back, wiped her off, and put her back in her bed for the night. Sitting all day in your own filth, it turns out, leads to bed sores. The day she was admitted to my facility, her family, my administrator, and everyone were all talking in her room. They had introduced us and let her know I'd be taking care of her at night from now on. She whispered to me that she needed to go to the bathroom, and I had to kick out my boss and her family because her son insisted that she can just hold it. She was never able to get over the raging infection in her wound, and it eventually killed her. It was one of those situations where I honestly wish I could have looked them in the face and told them, you know, that you're the one that killed your mother, right? You killed her. Edit: thanks for the gold. It's my first, so I'm not sure what to do with it. Just as an update, yes, we tried to turn them in for elder abuse, but she was actually still of sound mind and realized what we were going to do, and so she recanted her story and said she had never told us anything like that. She didn't want to see her son in jail for what he did to her, so she went to her death telling people things had just gotten out of hand and she was too weak. Doctor here. have had to explain countless times how aspirin, Tylenol and Motrin are each different medicines that do different things. Also learned that most people have no idea what they are taking or how much. Edit with some fun facts about each medicine. Point: aspirin causes platelet inactivation and has some pain relieving activity. Main risk with aspirin is bleeding in people with a predisposition, history of GI bleeding, etc. Tylenol, acetaminophen, has pain relieving effect and reduces fever very effectively. Important thing for people to remember is there is risk of major liver toxicity, possibly deadly and irreversible. Different hospitals use different thresholds, but generally safe dose is under 3 grams per day. Also important to know that meds like Percocet are opiates mixed with acetaminophen, Percocet, so again there is risk of odd there. Point: Motrin, ibuprofen, anti-inflammatory drug with pain relieving properties. Major risks are stomach ulcers and kidney injury with high doses and prolonged use. Point: Edit 2. This does not mean any of these are particularly dangerous to an otherwise healthy individual. Obviously talk to your doctor before starting a new medicine. One more point: I was talking to a patient about an upcoming surgery and asked her, has anyone in your family ever had problems with anesthesia or being put to sleep for surgery? She said yes. My mom died under anesthesia. This got my attention and I asked, when did this happen? And she said about 10 years ago. I asked a lot of other questions trying to get a handle on what had happened and how the events of her mother's death might relate to the risk of surgery for the daughter. Some complications run in families, others are unique to the individual or the illness, and it's important to have a solid handle on that before surgery. Point: I finally asked her, how old was your mother? And she answered, she's 65. I noted the present tense and asked, your mother was 65 when she died? The patient answered, no, my mom was about 55 when she died. She's 65 now. At this point I gently laid my pen down and took a deep breath. So your mother is not actually dead. It turns out that people love hearing they died on the table, or we lost you, or some variation of that. I have no idea who tells them, or where it comes from, but I've never had a patient die who didn't stay dead. Point: TLDR. Had to explain to a patient the difference between dying and having your heart beat out of rhythm for a couple of seconds. That vaccines are needed to help keep people and pets from getting terrible diseases and dying horrible deaths. Work at a vet clinic and a puppy was diagnosed with parvo, which FYI is a terrible disease that can be prevented by vaccination. It kills by making the puppy shit and vomit themselves to death, essentially, which was exactly what our blunt doctor told them. The owner said they didn't want to get the dog vaccinated before because they believed it would cause the dog to develop autism. Point: they then left walking the dog out to our protests, spreading a highly contagious disease through a store filled with pets, including people bringing their puppies in. Point: and called today to get some anti-nausea medicine so the dog could get better and be back to his old self instead of sick. Gross and annoying. The doctor had to speak with them again on the phone and just basically, short of yelling, said, your puppy is dying. Anti-nausea meds will not fix him. Taking him to the specialty hospital and having him admitted may save his life, but since you keep yelling at me saying you have no money, then you need to take him to a shelter to be out to sleep so he doesn't die suffering because of your stupidity. I did not know I was circumcised until I was 22 years old. Point: I somehow got the impression that circumcision was the removal of the mushroom part because a dog had recently been neutered, and I assumed circumcision was a part of that process. And I had happened to see the dog's penis a few times, and it was without a mushroom. Point: one drunken evening, many years later, my friends and I were all in a discussion about various penis types. Girls were around also, and we were all telling our own opinions and asking the girls this. Well, it slowly became apparent something was wrong. Girl, I prefer them circumcised with a nice mushroom, they just look nicer. The odds ones look weird with all that extra skin. Point: me. Wait. What do you mean you hate the extra skin of a new and circumcised penis? I'm not circumcised, and I have no extra skin. Maybe I do not have as much. We pull out a laptop and look at pictures of what penises look like in various states. I'm in shock. Point: I call my mom over to my room. Point: me. Mom, was I circumcised when I was born? Mom: yes. Of course, my mind was blown for a few days. It was one of the last times I made assumptions so lightly, and the beginning of me having a much deeper need to investigate things more thoroughly. Someone I knew, when I was doing my welding training, was a nurse. I assumed stories like the one he told me were why he was switching careers. That and welders make serious cash. A guy came into the very paranoid and twitchy, but seemingly otherwise alright, until he turned his back on one of the nursing staff and revealed a knife handle sticking out of his back. Someone had stabbed him in the back and left the knife there. The guy wouldn't believe it. He said his family had made him go to the but he thought they were crazy. Several doctors and nurses, even with a combination of mirrors, an x-ray, and pictures on camera phones, couldn't convince him he had a moth faking knife sticking out of his back. He kept insisting they were trying to scam him. Even when he put his hand back there and felt the blood, he insisted they put it there and that it wasn't his. Eventually they got him into surgery and removed the knife, but for a good hour they had at least 10 people trying to convince this guy that yes, he did in fact have a knife stuck in him. You'd think, sir, you have a goddamn knife in your back, wouldn't need much more explanation than that, but for this guy it took some convincing. Pharmacy tech here. I once had a patient ask if taking 2 1mg Klonopin was the same as taking 1 2mg Klonopin. I was stunned. Edit. Fuck me for thinking this is common sense. It's the absolute most basic arithmetic imaginable. If you can answer 1 plus 1, you can figure it out. Seriously. You guys can put your pitchforks away now. Edit 2. Since this obviously requires clarification, I was not at all mean or condescending to this woman. I explained to her that taking 2 of her 1mg pills would indeed have the exact same effect as taking 1 2mg pill. Just because it stood out to me as one of the dumbest questions I've ever been asked, doesn't mean I berated the poor woman for it. I'm pretty sure I had a relevant answer to Op's question. On that note, this thread is reminding me how much working in retail faking sucked. So glad I no longer have to deal with smarmy know-it-alls who think they know better than their doctors and pharmacists. Edit 3. Fuck it. You guys win. Don't ever listen to your pharmacy tech. I'm going to have an aneurysm if I have to answer any more questions about this retarded sheet. What am I, at work right now? I'm not even getting paid for this. This is especially important for all those who are considering natural treatments and seeking naturopaths for treatment as opposed to a physician's consultation. I've had many questions regarding natural alternatives, but this case stood out to me. I had a 22 years old female patient come into my OB rotation during my 3rd year of medical school with symptoms that pointed toward a yeast infection, bacterial vaginosis, but most likely a urinary tract infection secondary to an STD. No history of STD, but a recent skid with multiple sexual partners and unprotected encounters. Urine sample taken along with blood work. Tests were positive for chlamydia/gonorrhea. Simple antibiotic treatment. Standard of care equals azithromycin, 4 pills plus supra, cefixime, 1 pill. Instead, she elected to refuse the medication and told me she would be using garlic, as that is what a naturopath recommended. Despite adamant attempts to convince otherwise, she declined. Fast forward 7 months. I'm now in my emergency rotation and the same patient comes in when I happen to be working. Fever, touchy, intense sharp, stabbing right lower quadrant pain. Pregnancy test positive. Part is diagnosed with pelvic inflammatory disease, PID, most commonly secondary to untreated G/C. Further, imaging supports an ectopic pregnancy, future fetus implanted in the wrong spot in the female reproductive system. Ectopic is also common secondary to PID. Having PID, fallopian scarring, ectopic pregnancy and a near-death experience was worth taking the natural route, when a simple antibiotic solution could have avoided this. I would argue against that point. Natural products do have their place, but your doctor is likely aware of natural alternatives, where they are warranted. Discuss them. To be clear, her case was 99% avoidable with the use of simple antibiotics. Have a similar story with a patient who declined pneumococcal vaccines for her children cause of all that alternative media mishype. Her son got into an accident, had his spleen removed, to which she still declined the vaccine. Child developed meningitis 6 to 8 months after that occurred. Survived. But again, avoidable point moral: if you are going to educate yourself with information online, use credible sources, especially those that don't completely discount an accepted, tried and true expert, or at least someone who is absolutely qualified to give an accurate response. Puff. Alright, now for the old switcheroo. My ex-mother-in-law was a pediatrician. However, her education was all from the 60s and 70s in Cold War Poland, and she hadn't practiced as a pediatrician for 30 years when our daughter was born. Like a lot of first-time parents, we read all of the books, and the vast consensus at the time was that the only thing babies need is mother's milk. So we set ourselves up for that, and the baby is thriving after a couple of weeks with our doctor telling us everything is fine. Mother-in-law comes to visit, and of course we are doing everything wrong. We can't hold the baby right. We are being too attentive. We are not being attentive enough. She's too warm. She's too cold. I think you expect a certain amount of that, but then she starts insisting on giving the baby sugared black tea in a bottle. I'm not the smartest guy on the planet, but I'm smart enough to let the wife and her mom settle this between them. Lots of screaming back and forth. Showed her the literature from our doctor about nursing, all of the references in the baby books. Pulled down a couple of recent research articles, but the crazy old battle axe didn't give up. Finally I caught her, after we foolishly left her alone with the baby for a couple of minutes, trying to force her to take a bottle with tea, and at point she yelled at my wife, "In a week I will go back home, and then you can do whatever you want with the baby." In a level voice I told her, "That's what you don't seem to understand. We can do whatever we want with the baby right now." Well, it's not just a one-timer. I got those a few times. About 2 years ago, I was working as an intern in OB/GYN in a little hospital near where I live. Just to put things in perspective, I live in France, and the town where this hospital is located is inhabited by a majority of migrant families. Immigration in this town started at the beginning of the 20th century and is still strongly going on. It is also, as many cities of this type, globally poor, though some parts are really rich. Anyway, thing is, most of those families are from Arab origin, and sexuality isn't the craziest topic to be discussed at dinner in some of those families. It ended up bringing a few funny moments I'd like to share. I saw a girl in her 20s and her mother once who came because she puked a lot and was bleeding from down there. Turns out she's pregnant. Right when I announced it, both the mother and the daughter yelled at me, "That's impossible. We are both on the pill." I then answered, "Well, contraception is never 100%, particularly if you sometimes forget your pill. Did it ever happen? Do you often forget to take the pill every day?" Then the mother answered me, "No, we never forget. I take it on even days. She takes it on odd days. We never forget." And then it took me around 40 minutes to explain how contraception worked. Another time, a young girl came in. I diagnosed her with candidal vulvovaginitis. Wikipedia tells me it's commonly called vaginal thrush. When I wrote the medical exam in her medical file, I noticed it was the 6th time in 8 months she'd come for the very same reason. I found it awkward and decided to investigate a bit. She explained to me that, since the first time she had contracted it, she was being very hygienic. I asked for details, and she told me that every morning, she used a dildo-shaped shower head to wash the inside of her vagina and then brushed the inside with soap and those bottle brushes we use to clean baby bottles. Had to explain the whole concept of vaginal flora balance and everything. Third one before bed, a short one. I wasn't in the I was with one of the seniors doing regular consultations. A 50-ish woman comes in. She used to be followed by the MD I was helping. We examine her, check her breasts, do her smear. Right before we end the appointment, she asks, half startled and half angry, "Dr. B, I don't understand. I'm in my 50s now. Why don't you check me for prostate cancer?" I couldn't help but laugh for this one point. If anyone reads and likes this, I might add others later, if I get the time. Hope you enjoy. I'm a med student, but this is what I've heard from other docs have dealt with that me or my girlfriend has seen firsthand. Pouring hydrogen peroxide into the port we sent you home with is neither more helpful or more natural than the drugs you should have used. Vaccines don't cause autism. This must be said here and at least once a day now. Having friends forcibly shove a pool noodle up your rectum hurts for a variety of reasons, notably you destroying your sphincter and rectum, led to needing a colostomy bag. At the age of 22, he was a frat guy at a pool party. It's physically impossible for your baby to fall from standing to his tummy and break his femur completely in half. No bone diseases. This was blatant child abuse, and the mom was upset cause we'd be taking this kid from her too. Your kid's liver failed because he had a viral infection. Diagnosed and gave him aspirin. Do not give kids with a viral illness aspirin. And yes, it said it on the box that you conveniently brought from home. We are waiting on the new bed crane to be able to move you to your new room. No, we can't use the one your brother was in because that only lifts 500 pounds. The one from downstairs has a maximum of 1000, so we have to wait for it because it's currently in use. I can ask more friends in my class are the good ones they've had. Edit 1. Spelling. Lead equals lead according to English. On different tack. Things people don't generally know but should always take a second to check your surroundings before helping an injured person. The last thing anybody needs are 2 injured people. Never move a casualties unless they are in imminent danger. Never remove headwear unless you absolutely have to. The motorcycle helmet may be keeping the patient's spine in place or putting pressure on a bleed. Never pull objects from injuries unless you absolutely have to move the patient out of imminent danger. You will absolutely do more damage and their initial injury will be harder to treat. If you tourniquet an injury, understand that you have essentially written it off. I'm not going to say don't do this. If a person's arm is hanging by a thread and bleeding profusely, it might be correct, but do understand that TOURNIQUETS equals AMPUTATION most of the time. Call the manuscript and stay on the line. They can coach you through basic stuff, and having them in your ear can be steadying. Edit. If you have time, take a simple first aid course. You'll likely forget almost everything and hopefully never use it, but even if it gives you the confidence to stop by someone who might be hurt and call EMS for them, it's helping. Edit 2. This does not override previous training. If you have been trained to as when to properly apply a tourniquet and carry one with you, go for it. If you have the training to provide primary care, do what your instructors taught you. I work as a prenatal and postnatal counselor for low-income families, so I'm asked a lot of questions that would make most people want to break down in tears, weeping for the future of humanity. These genuinely don't bother me. Most families that I see have come to us voluntarily and are trying to ensure their child's health and well-being. Don't know what colostrum is? Great. I'll teach you. Can't change a diaper? That's what this doll is for now. To pay the bills. I also work as a doula and nursing coach. What is the difference between that and my other work? Abso-fakingly nothing, except when you slap a faking nonsense word like doula onto your business card, people throw money at you like you're a goddamn rock star. I get the most confused when well-educated women come to me and don't know shit about their bodies or their babies. If you are a lawyer, I expect that you are able to do research. It seems like a job requirement. A few gems. But Bonnaroo, if I breastfeed my second, then my older son will just try to start nursing again. Aren't they attracted to the smell? Her oldest was 3 and had been weaned around 1. What is a placenta? I had a C-section, so I shouldn't be pregnant again. I should sue my doctors for screwing it up for the 3rd one. I had to explain the difference between a hysterectomy and a C-section. She was a biology teacher. Some of my favorite insane moments are from my days as an on-call nanny in college. Those were more about basic childcare than medical knowledge, so I'll save those for another thread. I was rounding in the trauma intensive unit one morning and walking from bed to bed talking to patients' families. Most of the discussions were grim as the patients had severe injuries and were on ventilatory support, breathing machines, and some were requiring blood transfusions and fourth medicines to keep their blood pressure up. Sitting up in one bed was a guy who had been in a car wreck and had, this was a while ago, but I'm pretty sure, a liver laceration seen on a CT scan. These can be catastrophic if they bleed, as the liver gets 25% of the body's blood washed through it every heartbeat, and is essentially a giant, fragile blood vessel. Anyway, this guy had not bled, and was stable as a rock, and was getting ready to be moved out. He was sitting up in a lounge chair, drinking coffee, talking to his family, and watching a daytime talk show point as I finished discussing the plan and prognosis with the family and was preparing to move on. His parents pulled me aside and whispered to me gravely, "Doctor, is he on life support?" I looked over to this guy sitting up, drinking coffee and watching The View, and fought down the temptation to reply, "Yes, ma'am. It's only the machines keeping him alive at this point. Understand the family's perspective completely." Still funny.